One of the first ones that I hear often is, IVF is going to work, and it is going to work so I can wait. IVF works for a lot of people, and it is a fantastic tool for many couples or individuals trying to build their family. But for some patients, it's not really the best strategy, and they're not the best candidates. And so holding off on building your family or getting a fertility evaluation because you think IVF is going to absolutely get you to the family that you desire is probably not the best approach. Conversely, on the other end, there are people that think that if IVF failed the first time, it's going to fail every time. And that is also not true. So when we do an IVF cycle, it is not only a treatment cycle, but is also partially diagnostic. We can see whether fertilization occurred, whether there was enough mature eggs, how was the blastocyst formation, was there good implantation? So there are a lot of questions that we can explore while we do IVF. And if the first cycle doesn't work, we can understand at what point it failed and also optimize future cycles with different treatment strategies. So if it doesn't work the first time, it absolutely does not mean it's going to fail every time. And it is important to talk to your doctor about different options of making the cycle subsequently more optimized. Another myth for IVF is that it takes months and months of injections to go through a single IVF cycle. While there are some stimulation cycles where you need to have priming medications before you start the cycle, the actual stimulation, the controlled ovarian stimulation cycle, really takes 8 to 12 days of injections. So it's a lot shorter than most people think to get to egg retrieval for IVF. And then finally, I think a lot of people think that for IVF, if you're going to go through an IVF treatment cycle, you're going to end up with twins or higher order multiples. And that is really not true anymore. IVF was initially responsible for a very high increase rate of twins and higher order multiples in the United States. But since single embryo transfers have been used widely across clinics in America, the chance of having twins is actually pretty low when we use IVF compared to other fertility treatments. And so if patients are worried about twins or higher order multiples, please talk to your doctor, but most likely you'll be getting a single embryo transfer, which is recommended for good quality embryos.